technical aspects. Thank you. So now, thank you very much, Dr. Watts, and we're going to move on to Dr. Brown, who needs no introductions, really. Obviously, has been an incredible component and really a key member of ALS ONE, and is the professor of neurology and director of the Day Neuromuscular Research Lab at the University of Massachusetts Chan Medical School. I know we all know Dr. Brown for many of his breakthroughs and discoveries, starting from the discovery of the SOD1 gene, many other genetic causes of ALS and modifiers. And today, I believe, he's going to be talking to us about some of the translational potential of and translational techniques that really he led and really is leading, including these new modalities for gene silencing, which is so exciting, starting from SOD1, but I'm sure could be applicable to other diseases in the future. So, Dr. Brown, thank you so much for accepting the invitation to be here today and for telling us more about your exciting research.
Thank you so much. It's a great pleasure to participate in this symposium again this year. Really, kudos to you and to the whole ALS ONE team. I am going to talk about work we've done with Anastasia Farova to look at a new approach to gene suppression using so-called divalent siRNAs. I'll pick up on some of the themes Jonathan has outlined so very well. My work reflects the efforts of many individuals. I'll try to acknowledge them as I go through the talk. To my knowledge, I have no conflicts as I present this. The fact that there is familial ALS widely accepted by us was actually first noted by William Osler in 1890, describing the case of a Samuel Farr, who was in a family with a known ALS history. We now follow actually the great-great-grandchildren of Samuel Farr and have demonstrated that they have an SOD1 A5V mutation. But the key thing is that through that original insight, we've moved, of course, into a broad understanding of the genetics of ALS. It's striking that more than 200 mutations in the SOD1 gene have been reported. At least 50 are robustly verified. And so actually, about 80% of familial ALS genes are identified. What's striking is that it's become clear, as reviewed in this very nice paper by Brian Traynor and John Landers, is that about 25% of sporadic ALS is also, in fact, familial, not necessarily sporadic. And what's quite interesting is that the genes that are involved in sporadic ALS are represented in the same frequencies as they are in familial ALS. It's just that they are less frequent. And as we've already heard twice this morning, these genes are generally thought to act by one or more toxic gains of function. And so the challenge then is, can we suppress the genes and thereby alleviate the disease? And I'll just emphasize that the amazing work we've heard from Tim Miller invoked the so-called antisense oligonucleotides, and Jonathan has just given us a brilliant overview of how they work compared to siRNA. But this is just to remind us that, in fact, the ASOs work predominantly by getting into the nucleus, binding the target RNA, and invoking RNase H, whereas the family of duplex DNAs that are represented by microRNA, shRNA, and siRNA act predominantly in the cytoplasm by bringing the targeted RNA into the RNA structure represented by agronot and its adjoint proteins, leading to digestion of the target RNA as well. So we've been interested in this approach for a very long time. We first showed with Jeff Rothstein that one could use RNAi to suppress wild-type SOD1 in culture. We then showed with Maxwell and others that we could suppress a phenotype in mutant SOD1 cells in culture. We've spent a lot of time bringing this forward into animals. Since coming to UMass, we've had the privilege of working with Miguel San Esteves, Chris Mueller, Stoica, and others, demonstrating that in the ALS mice, we could achieve a very substantial increase in survival time with intrathecal injections of a synthetic RNA that targeted the microRNA that targeted SOD1, as I've shown here in this survival curve. The same microRNA was equally beneficial when applied to wild-type monkeys. In fact, we did this in 3 different strains of monkeys with really excellent suppression after intrathecal delivery of the endogenous SOD1. And then we took this into a small N=2 pilot human study. And to cut to the chase briefly there, what we found was that in one individual who had the same mutation that you see in the original reported family, the A5V mutation, we were able to get excellent suppression up and down the spinal cord of SOD1 with a virally delivered form of this microRNA. And you see that in the Western blots denoted by the arrows, as compared to either other patients with the same mutation untreated or healthy controls. What was striking in this patient were two things. One, which I won't show here, is that even with this very, very aggressive form of ALS, he showed some slowing of disease and indeed some reversal basically in one limb within about 4 to 5 months after treatment. Secondly, his right leg, which essentially we expected to get fully paralyzed, as we always see in these patients, did really very, very well. And in fact, even a year and a half later, when he finally succumbed to the disease, he was able to push himself around using his right leg in the wheelchair. And what was striking as I walked into the neuropath room is that the pathologist said, you know, I've never seen this. There's preservation of motor neurons in the lumbosacral spinal cord on the right side. So we think that this reflected potential benefit, where we have a competition between that benefit slowly realized by such things as regrowth of motor neurons versus the aggressiveness of the disease itself. The second patient we did, I'm going to tell you, is still alive. He has a mutation which is expected to progress much more slowly, but in fact, he hasn't progressed. This is someone who's been followed by James Berry. So what I'm turning to now is a different type of siRNA, a so-called divalent siRNA, which was discovered by Anastasia Kvarova, which is a configuration in which two duplexes are brought together, which greatly facilitates distribution of the CNS and provides very, very long-lasting suppression. In this case, a lot of the work was done using Huntington gene as a target. And I'll walk through just a couple of images to explain it further. This shows the structure of the molecule of interest. The actual guide strands are longer. You see them on the outside. The passenger strands are on the inside. And essentially, this is synthesized by making one long strand that has two passenger strands, and then essentially mixing that with two guide strands to get the structure you see in front of you here. And there's modification of the chemistries to augment stability, and a variety of them, in fact, which again reflect the I think the wisdom and the great advances that Anastasia Kvarova and her lab have made. How does this benefit as compared to the monomer? Well, when they use monovalent duplexes, they get very poor penetration into the brain and very minimal suppression. When they use the divalent structure, in this case labeled with Cy3, which is the red marker, they can show very widespread movement throughout the brain with really widespread distribution and excellent suppression of the HTT gene in multiple regions of the brain for up to at least 4 months and going on towards 6 months as well. And they see uptake by multiple cell types, not just neurons, but also putative neuroinflammatory cells. In the spinal cord, they see comparable results. After a unilateral ICV injection of 25 milligrams, they get really very good suppression in the spinal cord. That's the lower right here of the HTT gene, particularly in the gray matter, as I think you can see in multiple regions: lumbar, thoracic, and cervical. So this has motivated us to work with Anastasia. We've been thrilled to do that, to see if we could develop similar reagents for SOD1. This is a screening done in HeLa cells, looking essentially for a walk across the coding sequence, showing that there were a few sequences that put essentially a fairly good suppressive profile across SOD1. The IC50s are fairly reasonable for the best compounds as shown here. Of course, we took them immediately into a mouse trial. I say immediately, it was actually a long trial, but we were very urgent in approaching this. And what you can see here is essentially a very, very remarkable, we thought, impact of the intervention, which whereas PBS treated and untreated animals only survive about 140 days, the treated animals, as you can see here, survive, some of them out to 300 days. And this is after bilateral ICV injection, but only once at 6 weeks using 5 nanomoles. So this is really a modest intervention with a huge impact. The mutant RNA was suppressed by about 50% or so. The protein was knocked down by 75% or so. So very long and durable effect. The behavior, as you might anticipate with a survival curve like that, mirrored the benefit in terms of both grip strength and sustained weights over the lifespan of the animals. We noted in the first result that if you looked at the beautiful work by Tim Miller with Alex McCampbell and others on tofersen, in fact, the suggestion was that this type of bivalent SOD1 as we say, dicy RNA was probably more potent than tofersen. This shows us at the top of the data I've just shown you, at the bottom, the tofersen data, where there were 2 ICV injections at 2 different dates, much higher concentration with essentially comparable impact here, having used more of the reagent to start with, more of the ASO. But the key point to remember also is that the work by McCampbell was done in the all-black 6 mice, which generally have a longer survival. So I'll come back to that in a moment. Encouraged by these data, we then worked through 5 or 6 different modifications of the types of dicy RNAs that Anastasia had generated, trying to tweak the chemistries in ways which would optimize overall benefit. And what you see here is, in fact, one of the modifications now compared directly to tofersen, which is in light blue. And again, you can see that particularly in this more aggressive ALS model, tofersen does indeed produce a benefit of about 15 days, but in fact, that is outperformed by the dicy RNA substantially. In this case, we used 2 injections at 6 weeks and at 12 weeks. So we started some at 6 weeks, some at 12 weeks. And to start earlier is to have a better result. When one looks at these animals in terms of weights, disease score, either following 6 or 12-week injections, one can clearly see the benefit of the dicy. But what's interesting and worth pointing out here is that the dicy animals, as shown, I don't know if you can see my cursor, by, for example, the red triangles here, actually show some onset of disease. It's just that plateaus or progresses very, very slowly. And then there's a sort of ski tip upgrading or acceleration of the death process at the end. So they're not quite normal, although they certainly look normal in the cage. This is the latest reagent that we've used, P3C versus another one, P5C, again showing survival out to approximately a year. And I'll just say that there is corresponding benefit in terms of both assaying the RNA in the animals and also the protein. So this we thought was quite encouraging. In this particular experiment, we looked in more detail at some of the parameters of the benefit. What we found, for example, was that when we looked at the neuromuscular junction, we found that the therapy it essentially rescued the denervation process quite substantially, looking at pre and post-synaptic staining here. We also looked at neuroinflammatory changes. A couple of things here. One was that, at least in our hands, in the ALS mice, we did not see anywhere near the degree of neuroinflammatory change that we saw in the spinal cord. We didn't see as much in the cortex as in the spinal cord. And when we saw it in the spinal cord, it was really not substantially changed by the intervention. I would also tell you that there was a suggestion in the motor cortex that, in fact, the treatment itself may have provoked at least some microgliosis. This is looking at GFAP, where again, we see very little in terms of astrogliosis in the motor cortex. We definitely see it in the ALS animals in the spinal cord. It's somewhat better when we treat the animals. So what I think I can say is that there's a hint that there may be an irritative property of the disiRNA, but it's very minimal. In some cases, such as in the astrogliotic process, it may actually be benefited by the therapy. And I won't go over this in detail, except to say that we looked at synaptic integrity in the brain and spinal cord in the actual CNS tissue, looking at synaptophysin as a presynaptic marker and PD95 as a postsynaptic marker, and looking at the merging or overlapping of the two. And I realize going over this, it's probably not as visible as it should be for a PowerPoint and a talk like this. But if one looks at the transgenic animal, one can see that particularly in the spinal cord, as shown where my cursor now is, and again here, that the markers are underrepresented in the untreated ALS animal, but with the treatment, in fact, they are again visible. And I'll just tell you that we've quantified this, and it looks like it's statistically significant, although I don't think that's clearly illustrated by the histograms at the bottom. So that really is the core of the DICI work, represents actually 3 or 4 years of repeated efforts with different versions of the DICI molecules. What I want to point out, though, is how rapidly and wonderfully the field is changing, because there are still other approaches that are evolving that may supplant what I've just shown to you. And so here is one, which was reported in bioRxiv by a group in China, represented by Ractogen Therapeutics, in which they have created an siRNA with an adduct, which is a small oligonucleotide, which itself is non-functional other than serving as a moiety that stabilizes the siRNA and undoubtedly somehow permits better brain permeation. And in this particular experiment, what they found was that in a dose-dependent manner, in the same ALS mice that I've just described, they could also achieve a superb extension of survival and corresponding retention of growth and weight and other behavioral features. So this, I would say, is, again, very much like what Anastasia's reagents produce, and is very, very encouraging. It allows one to dream that this is a therapy that, for example, might be used once or twice a year and produce enough suppression of SOD1 to be clinically beneficial. But now this is taking us full circle back to an AAV-mediated delivery of a dual synthetic microRNA that treats, again, targets and suppresses SOD1. This is from the brilliant work of Shun Shi, Fang Wang, and others in Guangpeng Gao's lab at UMass. What they have achieved here, and this is a potential interest in view of some of the subsequent talks, is a system in which they promote expression of this by using the survival motor neuron promoter. And what is, I thought, particularly striking is that in this experiment, they were able to achieve this result, which is a 100-day extension of survival following intravenous delivery. And I think for all of those of us who are involved with multiple intrathecal deliveries, and frankly, over time, one can see, as we've seen in some of our patients, progressive scarring that makes it a little bit tougher. When do you essentially stop doing this in the clinic and start doing it with neuro-IR? All of that goes away if one can do an IV infusion. And furthermore, if it is true that for AAV, the therapy is one and done, one could imagine that this might, in fact, only require one therapy. Now, obviously, when one looks at these mice, they do eventually die at 100 days. But my point is, this, I think, and the result with the DICI, either from our lab or the results in China, strongly suggest that new structures, new scaffolding, new architecture is going to take us into some new realms where the delivery will be greatly simplified and the benefits greatly enhanced. And I just can't resist ending with, again, a shout out to Jonathan Watts. He alluded to this briefly, who has now developed a new family of structures that involve siRNA coupled to an ASO, where one realizes the potential relative benefits of each of these. And with this, one can imagine targeting two particular elements in a pathway at once in a way that may ultimately be very important. There's a long literature suggesting that, in fact, to some degree, There are roles for polygenetics in ALS, certainly in sporadic ALS, and that, in fact, if that's the case, one could imagine treating more than one target with this incredible reagent that looks very promising so far. So I'm going to stop there. Again, I would just conclude that these new bivalent or dicRNAs really do achieve long-lasting SOD1 suppression. They increase survival. They do not entirely shut the disease down because the mice do show evidence of early changes in the neuroscore, but that plateaus, and the survival results are what you have seen. Otherwise, I would say this is very safe. It clearly rescues synaptic integrity, both in the parenchyma of the CNS and of the neuromuscular junction. And what's amazing to me is that this field is just exploding, and we are going to see, I think, other advances which may yet greatly improve on what we're working on here. Thank you. I don't know if there's time for any discussion, but I'm certainly willing to entertain questions.
Thank you so much. This was mind-blowing. I see comments in the chat saying that this is really exciting. Obviously, we completely agree. Thank you so much for sharing these really new opportunities. We do have time for a question, I think. So if anyone has a burning question, you can put it in the chat. If not, we will have, again, time later during the panel discussion at 3:30 Eastern. If there's no questions, Dr. Brown, may I ask you, what do you think in terms of translation of these exciting data into trials? What's the timeline? I know we have many people living with ALS who are attending, and I'm sure they're wondering, what's the timeline for translation?
Yeah, so that really, I think, raises some very, very important questions. So, for example, the reagent I showed you from China is being backed by a company. Okay, the amazing results with AAV9 are backed by also a different Chinese company. Mm-hmm. And there's another company, which I think you know about, Sabrina, called Arrowhead, which as a company is developing another reagent which overlaps to some degree with these. And I think what I'm getting at is there's a good discussion to be had about what does an academic do when there's a reagent that looks like it's potentially valuable in terms of the most rapid pathway to therapy development and the clinic. For non-ultra rare diseases, I'm coming to the view that the best thing one can do is ally with a company so that we have the resources and the infrastructure to take it forward rapidly. Dr. Schneider has done a brilliant job without going that route, and he may have comments on this as well. So number one, what has to be done for all of these is, of course, the appropriate animal testing, small and then large animals, with whatever degree of toxicity verification or proof one needs for the FDA. That's evolving itself. And then one has to mount the resources to do enough patients to have a real readout. It's exciting to do N=1 or N=2 if there is a benefit that looks promising. But what about everybody else, and how can one move forward most meaningfully to ultimately treat the most patients the most quickly? Great question, Sabrina.
Yeah, and there's lots of great questions that have come in. So maybe we can take them rapid fire if we can, and if not, we'll take some later. We have spoken a lot about SOD1. What are your thoughts about C9? When do you think there will be interventions for C9?
So I think they're around the corner. So to be biased, let me tell you that we did report one patient in Nature Medicine who had almost a complete shutdown of the biomarker in the CSF, and who alleged that he got substantially better. But that is exactly why I'm saying that was all well and good for N=1 for an academic. How do we get that as fast as possible into a large number of people? Anyway, we hope as a team working with our amazing colleagues at U and the rest of them at MGH to try to get this into a study very, very soon. But beyond that, there are editing approaches, which are CRISPR and others that have been reported for C9 in mice, and which I think will be forthcoming. As well as, and we've heard results earlier today about things like inhibitors of PIK5 and other non-gene targeting approaches, which may be beneficial. So I'm very optimistic, to cut to the chase, Sabrina. about C9.
That's great. There's a fascinating question about combining different types of gene targeting techniques. So the question is, obviously, that there's sort of all these preclinical data points to improvements, but not necessarily a complete cure. So how do you feel about combining two technologies? The example is AAV-mediated delivery with ASOs or other different technologies, I think.
I think in the end, we may have to do that. I mean, if for example, we can get 10 years out of one of the new wave AAV9 synthetic microRNA programs, then we might want to follow that with an ASO or a dicRNA. The question is, should we be using more than one approach right at the start? And that leads to the question of how much suppression is enough. And there's a whole nother important issue here. Okay, so in our SOD cases, we saw in the human remarkable shutdown of SOD1. In Dr. Schneider's case, he showed remarkable shutdown of FUS. But what if it matters that there still be some wild type enzyme or FUS still there? Do we have to move toward allele specificity? So we only, and Jonathan brought this up, we only shut down the mutant allele. I don't know the answer to that question. And the results with pan shutdown so far, as we'll hear with FUS, are staggeringly wonderful. But it's early days. So I think we may need more than one modality, Sabrina. But still, it's an open question.
Yeah, and actually, I'm going to skip one question and just to follow on what you just said. There's another question that basically asks about, can we afford complete suppression of SOD1 without causing harm, which I guess follows exactly what you were saying.
Yeah, that's right. And Tim himself said, we don't know in the really long term, and what he didn't show us, I'm sure they're accumulating the data, is the parenchymal shutdown of SOD1. What they showed us are very interesting CSF data, okay, where they clearly see a reduction, but I'm not sure what the parenchymal shutdown was. So
I'll go back to Dr. Mills' question. What are your thoughts on inducing protective variants with RNA editing, for example, to extend survival or prevent disease onset?
That's a great question. Yeah, I mean, I'd have to think through for example, if one could correct or edit the type of UNC13A that's present, and thereby essentially create a beneficial allele, if I understand the question properly, that might ultimately be great. I mean, there are several risk factor genes which are pretty well documented which are both relevant to sporadic and familial ALS, and I think to the extent that one might change those, let's say there's an allele that is potentially adverse from one of the 7 or 8 risk factor genes. If one could correct that, modify that at the same time that one treated the primary gene defect, or simply treat the risk factor gene in sporadic ALS where there is not a primary gene defect, that all might be beneficial. And I think that has to be in the armamentarium of approaches, frankly.
There's a question that is it actually important question clinically. Thank you, Peter, for asking. So what's the penetrance of the different gene causing mutations?
Yeah, so I'll tell you that SOD1, for carriers who live to be 75 or more, the penetrance is well over 90%, very high penetrance, probably more in males and females. We've seen some families in which we sadly lost a 22-year-old young man whose mother was still alive carrying the same mutation, but she then succumbed at age 70. So SOD1 is about 90+%. For C9, the best I understand is it's about 2/3. It's not as high. It's not as high. And that may be one reason, of course, why it shows up in seemingly sporadic cases. Yeah, I would say 2/3, yeah.
Yeah. So I think the last question that we have is essentially a question about, again, going back to combination treatments. How do we see what we are impacting with the different drugs? I think the question is more about, how to disentangle the impact of one drug versus the other. How do you measure the two components?
Yeah, I think I have 2 answers to that. One is that in an ideal world, we would have a different biomarker for each pathway that was implicated, and we could titrate and calibrate, and understand sort of like a bunch of chords in a piano, which particular element one had affected with which particular therapy and to what degree. I think the reality is ultimately we will determine what's the best approach to prolonging survival. and that we may not ever have that degree of resolution of pathway involvement.
Thank you. Thank you so much for spending time with us and also answering all these questions. It's really, really an honor to get all these questions answered from an expert like you. So thank you. And thank you for also staying later for the panel discussion where we